And finally, in our news, you might be familiar with snoring. Of course, we all are. But did you know that it could lead to a temporary stop of breathing during sleep? Watch as our EBC correspondents in Bangkok, Nicole and Aaron, who is also a registered polysomnographic technologist, discuss everything you need to know about obstructive sleep apnea syndrome. Take a look.
Sources, obstructive sleep apnea syndrome is the most common sleep-related breathing disorder worldwide. Meanwhile, in Asia, the prevalence of symptomatic OSA in middle-aged men and women is 4.1 to 7.5% and 2.1 to 3.2% respectively, according to a research published in PubMed.org. Today, we will understand more of this through a registered sleep technologist and fellow EBC correspondent based here in Thailand.
Hi, I'm Aaron Blue Calleja, a registered polysomnographic technologist with 8 years experience from the Philippines and now here in Thailand.
So Aaron, we would like to know what are the causes of this obstructive sleep apnea or OSA, and is this paghihilik in Filipino?
Okay, so thank you for that question. So let me clarify first. Paghihilik is just only one of the signs and symptoms of sleep apnea. Okay, but if you are snoring or if you snore during your sleep, possible there is a chances are you have obstructive sleep apnea. But some patients, even though they snore, they don't have obstructive sleep apnea. Obstructive sleep apnea, from the name itself, obstructive, meaning there is an obstruction to your airway while you are sleeping, and that obstruction can lead to stop of breathing, which is apnea. Apnea is the absence of breathing during sleep. And there are many causes why we have obstructive sleep apnea. So number one of which is the drugs we take. Maybe you are taking like sleeping pills or sedative before you sleep. It will cause obstructive sleep apnea because it relaxes our muscle, therefore relaxes the passage of airway. Number two is increase in age. So while we increase in age, our muscle weakens. So mostly like 30, 40, 50 years old above, particularly male, is prone to obstructive sleep apnea. Okay, based on this statistic, men have the higher risk of obstructive sleep apnea rather than female. But after menopausal years, female is prone to obstructive sleep apnea. Okay, next also is the increase in BMI. While we gain weight, particularly we have fatty deposits around the neck, we are prone to obstructive sleep apnea because that fat blocks the airway while we're sleeping. We also have craniofacial abnormalities. So on my experience on the practice of sleep medicine, it's not always the big ones or the patient who is fat are prone to obstructive sleep apnea. I have patient who is thin but have obstructive sleep apnea because of the craniofacial abnormalities. So some patients have small chin when they sleep on supine, so it moves backward. That causes obstruction to the airway. Okay, particularly we Asians experience that. Okay, increased nasal resistance may be also anatomical abnormalities on the passage of air through your nose. And if you have large tonsils and large adenoids, particularly on children, so the large tonsils and adenoids can block the airway. Also, we have the macroglossia, which is the enlarged tongue. So that's some of the causes of obstructive sleep apnea.
Okay, so now that you have discussed the causes, we would like to know the effects of this sleeping disorder.
So there are many effects of this obstructive sleep apnea in our body system. So let's do it one by one. So for cardiology or for the heart, so the patient may manifest hypertension if not addressed correctly. So we will also have left ventricular hypertrophy, or the left side of the heart is being enlarged. We will also prone to arrhythmias, or that is the abnormal heart rhythm of the patient. So there's also heart failure if we don't address obstructive sleep apnea or we ignore sleep apnea for the long term. For the psychiatry, you can see the patients mostly obstructive sleep apnea patients have depression, have an anxiety, have behavioral problems. So example, you don't have enough sleep. It's normal for us to be irritated, right, in the morning while we are working, while we are going to school, because you don't have enough sleep, okay? And also, some patients have acute delirium, can manifest acute delirium, okay? From the neurology, one of the bad effects of sleep disorder, obstructive sleep apnea, is stroke. So patient may experience stroke if not address sleep apnea correctly, okay? For the anesthesiology, some doctors, they prescribe sleep test before an operation to avoid difficulty in intubation, because we know that when we put anesthesia to the patient, it relaxes the whole body system, okay? It also relaxes the airway. Some instances, like if the patient manifests like decrease in oxygen, the doctor and the operating staff have difficulty intubating the patient. That's why some doctors check first if the patient is having obstructive apnea, okay? Next, for the urology or the urinary system, patient may manifest nocturia or frequent urinating at night. So it also affects the quality of your sleep, because usually when we sleep, there should be no interference. But when we have obstructive sleep apnea, some patient wants to go to the toilet in between their sleep. So the quality of sleep is not okay. And also it produces, or it can result to impotence, okay? And also erectile dysfunction for the male, okay? For the endocrinology or endocrine system, we can see some patients develop diabetes when they have obstructive sleep apnea, okay? And for the ENT, mainly snoring is one of the great factor for having sleep apnea. So when the patient also wakes up, they feel that the mouth is dry, they are prone to sore throat also, and hoarseness of voice, okay? For the gastroenterology, patient can be prone to GERD, or what we call gastroesophageal reflux, okay? And for the blood, patient can manifest polycythemia. It is the mechanism of the body to increase the production of RBC in our body, because when you have obstructive sleep apnea, your oxygenation in your body gets low because of the obstruction. So that's why our body compensates by producing more, okay? For the pulmonology, so for the lungs, patient can manifest nocturnal shortness of breath. So they are having difficulty breathing at night, particularly when they are sleeping, and also respiratory failure.
This is getting really interesting, and your job is very unique. Okay?
Thank you.
So probably they are thinking that OSA is just normal when you are tired, okay? But as you have mentioned, it could be serious, and we should not shrug it off.
Yes.
Now that our patient is sleeping, can you show us how did you diagnose our patient?
Okay, so before I show you how I diagnose the patient, so I will again reiterate that paghihilik is not normal, okay? We are thinking the patient have a deep sleep, but that is not true, okay? So I will correct the belief that paghihilik is equals to deep sleep, okay? Now, I will show you my patient. So before, we hook the patient to the sensors, we put this patient to the system, and now we are, the test or the sleep test is running right now. So as you can see, so this is our patient. So now he is sleeping in supine, and I said that supine position is the worst position when you're having obstructive sleep apnea, because when you are in supine or you are flat on bed, tendencies are your muscles here, particularly also your tongue, move backward, so it blocks the airway. So as you can see, the patient is now on N2, okay? So for you to appreciate, our sleep have stages. We have the N1, N2, and N3. So for the N1, that is the non-REM sleep. So non-rapid eye movement. There's no movement of the eye while we're sleeping. So NREM sleep is the light sleep, okay? So when you are feeling sleepy, you're entering the stage of N1. Okay. So after the N1, we go to N2. So N2 is the true sleep. Okay. And going to N3, N3 is the deep sleep. So that's the deepest sleep we had. Then after the deep sleep, we will go now to REM, or the dream stage. So overall, we have the N1, N2, N3, and REM, the dream stage. Okay. Then also, we add the wake stage when the patient is awake. Okay. As you can see, the patient now is on N2 based on the waves he manifested. Okay. The EKG is normal. Yes, we can also monitor the heart rate because usually some patient with sleep apnea manifested abnormal heart rhythms, what I said earlier, right? Then also we will check for the snoring. The patient snore. So there is a movement of snoring. So for this patient, he had mild to moderate snoring. Okay. So I therefore conclude this patient have obstructive sleep apnea. Then later, we will do the treatment of this patient by the use of the CPAP. CPAP is continuous positive airway pressure. That is the treatment of choice for OSA patient.
Okay, well, thank you. And how many minutes or hours should we wait so that we could fully, or we could get full information about the patients?
Usually, we do the sleep test for the full night sleep test. That is like 7 to 8 hours, like the normal sleep of the patient. So we ask the patient to do what he is doing normally when he is sleeping or when he wants to sleep. For example, if the patient wants to read books before sleeping, want to watch TV, want to take shower, he can do it naturally when you are in the sleep lab. Then, if you have the doctor's prescription about sleep test, or when we say split night sleep test, meaning you need to have the diagnostic and the other part you need to have the treatment. So for the diagnostic, that is 2 hours, and for the treatment, that is 4 hours. The treatment is the time we use the CPAP to the patient. And using the CPAP to the patient, we are now getting the optimal pressure, the pressure of the machine that helps the patient to remove or to treat obstructive apnea, to have like normal oxygenation during the sleep. There's no obstruction, there's no apnea, there's no hypopnea in the patient, and also there's no snoring.
Lastly, RN, for our viewers, we all know that each patient is different from each other. But what can you advise or recommend to us right now to treat, or more importantly, to prevent this OSA?
Okay, so particularly we are focusing now on obstructive sleep apnea. So one treatment can be like lessen your body weight. So you need to have a proper diet and exercise. So your BMI should be a normal range. And also, you can sleep not on supine, but sleep either left or either right to avoid your tongue moving backward and obstruct your airway. You are sleeping, avoid using your gadget 1 to 2 hours. Okay, don't use cell phone, don't play on cell phone, don't use your tablet, don't watch TV before you sleep 1 to 2 hours. Because the blue light of that tells our brain, okay, you should wake up. That's why when you are playing with your mobile phone, it does not help you feel sleepy. If you are smoking, avoid smoking or stop smoking. If you are drinking, like alcoholic drinks, so avoid drinking alcoholic drinks, particularly when you are ready to sleep. Because sometimes the patient or the people say that alcohol can help them sleep. But in fact, when you drink alcohol, you have like abnormal waves during your sleep. So it can affect also the quality of your sleep. Okay? And also, if you have manifestation of sleep disorder, particularly obstructive sleep apnea, ask the doctor as soon as possible to avoid any further complications in your body system.
Thank you, RN, for sharing your expertise to us. And yes, you are right. We are going to have more discussion about sleep on our next episodes. From Bangkok, Thailand, this is Crystal Nicole Di Marucot
And Aaron Lucaleja.
and we live in interesting times.